And what would you do if you don't have a clear diagnosis?
Yeah, that's a really good question too. And I think it's important to realize that we don't always have to have a diagnosis to treat patients with shoulder symptoms, as long as we have excluded all of those things that we talked about earlier. So as long as we know that they don't have a serious medical condition, an infection, cancer, ruled all of those things out. We know that they don't have a fracture or a dislocation or a soft tissue injury that needs surgery, as long as we know that the pain's not coming from the cervical or thoracic spine or the viscera or somewhere else. Once we've narrowed it down and excluded all of those things, even if we can't get to the specific shoulder condition or a specific diagnosis, we're really left with a group of symptoms that we then just have to decide how is best to treat those symptoms. And that's where the art of physiotherapy really does come in, because it comes down then to identifying what is driving those symptoms. What is the cause of those ongoing persistent symptoms? Now, there's some really good podcasts and resources available out there, and particularly from Chad Cook, if you look up any of Chad's work. But if you look at all of the factors that might contribute to symptoms in the absence of a clear diagnosis, if we can modify those symptoms with mechanical means within the session, so if you can tilt the scapula posteriorly or activate the muscles slightly differently or scapular assistance tests of any description, and it changes their symptoms, then we know that there is most likely a mechanical or a biomechanical physical element to those symptoms, and that type of treatment approach is likely to be helpful. I mentioned earlier the other factors that can influence the prognosis of patients with shoulder pain are things like the cognitive behavioural factors, psychosocial factors. Patient beliefs and patient expectations are huge in treatment, and we do know that what the patient believes to be the cause of their pain, what they believe to be the best treatment for their condition, and their expectations around what type of treatment they should have and their likely outcome have an enormous influence on their prognosis. So I treat those very much like an impairment, and I ask patients about these things just to see whether is there anything that comes up on my radar a lot in the category of patient beliefs or expectations that I feel needs to be addressed to help them move forward with their rehabilitation. Sometimes it may be just a persistent inflammatory type pain, biomedical kind of cause where perhaps they just need some pain management, maybe even anti-inflammatory medications prescribed by their doctor. So we can absolutely treat patients without a diagnosis. We don't always need one if it's not going to help our treatment. And then it falls to us really to just identify what are the factors that are influencing their ongoing symptoms, and how can we change that with biomechanical or mechanical treatment approaches, manual therapy, cognitive behavioural type approaches. It may need a bit of pain management or medical input for pain management as well. So as long as we've reduced the probability of anything serious going on so that we're minimising the risk of harm by ongoing treatment, then absolutely that we can treat patients without a diagnosis. And in many cases, that is what most physical therapists are doing out there.